Well, 2.5 years after the start of the coronavirus pandemic, President Biden declared the pandemic over. But he has since backtracked on some of those comments. But many health officers are saying that he was really sending the wrong message. Joining us now is the clinical professor at Stanford Health Medicine, Dr. Malathi Srinivasan. You're the clinical professor as well as being a doctor. Thank you so much for joining us. What do you think about Biden's comments on the pandemic being over?
Yeah, Liz, the off-the-cuff comments were really unfortunate because we need to separate marketing from the facts. COVID is still sweeping the globe, but like the flu, it's settling into a less severe endemic state. The Omicron is milder, but 1 in 13 people who get Omicron are still getting long COVID syndrome after the infection. And 400 Americans are still dying per day with Omicron. So declaring the pandemic is over has two consequences. The first, it lets the government drop extra healthcare and business funding that we're supporting American families. And this includes the additional 6% Medicaid funding under the Family First Coronavirus Response Act. So over the next few months, potentially 5 to 13 million Americans are going to lose their health insurance.
Wow.
And the second thing it does is it's going to disincentivize people who are on the fence from getting their COVID boosters, just as we're coming into the colder fall season where people are going to be more indoors and they're going to be less masked. So this is not the time to be dropping our guard.
Yeah, it's a lot of folks, I think, heard that and they thought, okay, I'm going to go back to living my life. And like it was 2018 and nothing happened. And you're saying, not quite so fast. In fact, we may just be sort of dealing with this in kind of micro doses for the foreseeable future for as long as we can see.
For a very long time, because, COVID is much, at least the COVID strains that we've seen are much more lethal than the flu, which is, of course, also causing deaths, but the rate is lower.
Sure.
So, yeah, I agree.
So, okay, let's turn now to booster shots. Both Pfizer and Moderna seeking authorization to provide updated booster shots for younger kids. Now, these are booster shots that specifically target the Omicron subvariants. When it comes to those booster shots, though, do you recommend mixing and matching? I mean, does it really matter if you received, a Moderna protocol and then you get the Pfizer booster or vice versa?
Yeah, based on studies from the initial booster, mixing and matching is both safe and effective. And if you're switching from the Johnson & Johnson vaccine to the mRNA vaccines, it's probably even more beneficial.
Wow.
The FDA, the CDC had recommended that you stick with the whatever you had gotten initially for your initial induction series. Mm-hmm. But for the boosters, it doesn't seem to matter. And I was just checking vaccine appointment availability in the Bay Area at our major retail pharmacies, and it's just really excellent. So the major message is please get the first available bivalent booster in your area.
I know I know myself included, my son, I made sure that he had his booster before the start of school. So if he had it or if child has had it in the last month or so, how long should you wait before getting him the next booster?
In general, you want to wait about 6 months. We think that immunity wanes at about 6 months.
Okay. All right. What kind of side effects can you expect from the booster shot? Are they similar to the side effects from the first shots, or does your body kind of adjust and maybe you don't have such a bad reaction this time around?
Yeah, the booster side effects are much milder than the initial COVID induction series because, in fact, the dose is about half as much as a primary induction. Okay. So the predictable type A reactions where you have your immune system revved up should be lower. And these are the standard pain at the injection site, muscle soreness, headache, being tired for a day or so, and low-grade fevers. Less than 1% of people are going to get these very, very strongly. What we're hoping is that the type B, less predictable immune reactions will also be low, but we won't know for a while. And this includes things like myocarditis, which has with the heart inflammation that people are worried about, that has an incidence of about 1 in 100,000 people overall, but it's generally mild and it resolves in a few weeks. But the thing to remember is that the complications that you get from the vaccine happen at a much higher rate if you actually get COVID. So myocarditis, for instance, is about 4 to 5 times higher if you get COVID versus if you get the vaccine. So the major message still is to sign up to get your COVID booster, first available in your area, and it'll protect you, your family, and it'll protect our community.
Yeah. And then one more question about those flu shots, because I know a lot of folks are going to be wanting to, they want to go to the doctor once and get it all done so they don't have to come back. Do you recommend that? Is that wise to get the flu shot and these boosters on the same day, or do you think it's better to spread it out? Any bad side effects from that?
We don't know yet. The people who I've seen in clinic have done really well with getting the both shots at the same time. So the data is still waiting. But based on what we know of giving multiple vaccines at the same time, for instance, if you get shingles and influenza on the same day, or tetanus and your influenza vaccine, people generally do pretty well. So your immune system's revved up. It's going to be maybe a little bit more revved up. But if your side effects were not too bad the first couple times, I think we can probably go for it.
You just may have a really sore arm. All right, Dr. Malathi Srinivasan, I'm going to get it right one of these days, from Stanford Healthcare. Thank you so much for your wonderful wisdom. Good to see you too. Thank you.